If you've heard the term cord blood banking, you might have thought, WTF? And you're not alone. This relatively new practice is making pregnant people scratch their heads about what it is and if it's something that's worth the money. So if that's you, or you're just curious about what the heck cord blood banking is, listen on. Okay, so first off, what is it? So to put it really simply, cord blood banking is the process of collecting blood that's in the placenta and umbilical cord right after the baby is born. And it's collected because it contains hematopoietic. So hematopoietic stem cells that can potentially be used to treat some types of diseases. And these cells, they can do this because they can mature into different types of blood cells. Other cells, however, skin cells, for example, they can only turn into another skin cell. So these stem cells are pretty special in that regard. And because of that, they can be used to treat over 80 types of diseases, like those that impact the immune system, genetic, metabolic, neurological disorders, blood disorders, and some kinds of cancers, like leukemia and lymphoma. Okay, so something that's important to look at is why cord blood stem cells are preferable to those found in bone marrow, because that's the other place where we can source stem cells. So a major benefit of getting stem cells from cord blood instead of bone marrow is because more people are typically able to use the cord blood stem cells than those found in bone marrow. There's less of a chance that the body will reject the stem cells that we source from cord blood. And it's a lot easier to collect stem cells from cord blood than from bone marrow. It can be a kind of painful process to get the stem cells from bone marrow, whereas with cord blood banking, it doesn't hurt the baby, with the exception of maybe it can impact their iron levels after birth, but they don't feel any pain when the blood is taken from the umbilical cord and the placenta. And cord blood, it can also be frozen and stored for an undetermined amount of time, whereas bone marrow, stem cells from bone marrow pretty much has to be used immediately after collection. Another perk stem cells from cord blood offers over, bone marrow stem cells is that they can actually help to strengthen the immune system during cancer treatments. So those are a couple of advantages. Some disadvantages of cord blood banking. So a major disadvantage of this process is that sometimes there's not actually many stem cells in the cord blood. This means that the uses for it might be pretty limited. Actually about 75% of cord blood units donated to public banks, they have to actually be discarded or used for research, which can be good, because they don't have enough stem cells to be used for a transplant. And some diseases that can be treated with stem cells require the use of stem cells from another person. So this is really key. So in this case, so think about it this way, stem cells from your baby's cord blood could potentially be used, for a sibling, for example, but a lot of times not for themselves. So this is actually the case for quite a few diseases. So for example, if your baby got leukemia, their own stem cells from cord blood collection couldn't actually be used to treat them. And the reason is that the child's cord blood, it couldn't be used because for their own treatment, because the cells would contain the same genetic defect that's causing the health issue. So again, collecting the cord blood a lot of times can potentially help other siblings, sometimes other family members, but a lot of times not the baby. And another factor is that the cost of storing cord blood in a private bank can be pretty high. The startup fee is usually somewhere between $1,000 to $2,000, and the yearly cost to store it typically ranges from $100 to $175 annually. There's usually often a shipping fee as well to have the blood sent to the bank, and sometimes a fee charged by the care provider to collect the blood. And insurance rarely covers this. And lastly, it's unknown if frozen cord blood is good after 15 years, but the jury is still out on that. So we still don't know if it can just be stored for an unlimited period of time or if it needs to be used after X amount of years. Okay, something else to look at is the difference between public and private cord blood banks. So what is a private cord blood bank? This is a place where you can pay to have cord blood stored, and it can be used just for your family. So no one else has access to it, only you if you happen to need it. But again, you have to pay for that. If you donate cord blood to a nonprofit public bank, you don't pay any fees, but the cord blood, it can be used for anyone that might need it, or it might be used for research purposes. So again, there's no guarantee that it will be available for your family to use, at a later date if you need it. And this is the option, donating, if you're going to collect the cord blood. The American Academy of Pediatrics, it recommends donating to a public bank. And this is because it just expands the amount of cord blood that is available for people that need it. So it can be a really, really great option. Some reasons to pay for private cord blood banking, one big reason is if you have a family history of a disease that can be treated with cord blood stem cells, it might be worth considering, paying to store these cells in a private lab. And another potential reason, if you have a child with a medical condition that could be treated with a cord blood transplant, it could be very wise to collect cord blood from the baby that you're pregnant with. Something cool is that the Children's Hospital, Oakland Research Institute, they'll actually foot the bill of cord blood collection if it can be used at the time of the baby's birth to treat a sick sibling. So, and some private banks offer a similar program. All right. So what do you do if you do want to privately store the cord blood? So what you need to do is at least 6 weeks before your due date, you'll want to find a private bank and you need to request a collection kit. Your family medical history will need to be reviewed. Your blood will be tested. The mother's blood will be tested. And you'll also need to sign a contract with the bank. You'll need to pay any applicable fees before the baby is born. And you'll want to be sure that you have the collection kit at the birth. And a lot of times you need to give your medical care provider a heads up that you'll need to collect the cord blood. So that's something really important to communicate with your care provider about. And right after the baby is born, what they'll do is they'll clamp and cut the umbilical cord, and they'll use a needle to extract blood from the cord. And then the blood, it goes into a bag that's attached to the needle. And something to know about this too is that sometimes not enough cord blood can be collected to be viable to store. So that's something important to note. So yeah, before deciding to do this, I think it's really important to talk to your medical care provider, consider your family medical history, and to seriously consider donating to a public bank, unless there's a really specific reason why you think the cord blood would from the baby you're pregnant with would benefit your family. So a lot of things to consider.